Hear you. Staying active is a simple move we can make to keep our bodies healthy, but normal exercises like running can even sometimes cause us pain and injury. Joining us now from Orthopedic Associates of Central Maryland is Dr. Rick Kinnard. Doctor, thank you so much for joining us today.
It's a pleasure, Jen.
So, even though you think you might be running and you might have rolled your ankle or you think you've sprained it, you could have actually fractured it, right?
That's possible. I think if you hurt your ankle while running and you're having pain or trouble walking, I think it's important to decide or have a physician decide whether or not you've sprained a ligament or actually broken it, because the treatments can be different.
And some of the, whether or not you've sprained it, I mean, that could be as simple as an ACE bandage versus a fracture where you might need a cast or a realignment of the bones, right?
It's always not that simple, or not always that simple. I think that, a sprain actually can sometimes take longer to rehab than a fracture. A fracture we might immobilize for a month or 2 months or longer until it heals, and then do some rehab, and I think you'll be fine. With a sprain, I think the rehabilitation is even more important. I think it can take even longer to recover from. So the treatments being different, I think it's important to have it checked out and do the right thing.
Sometimes the older we get, we kind of push away the pain and maybe just take, an ibuprofen, and when actually there might be a problem, whether it's pain in your shoulder from golfing, years and years of golfing. How can you tell the difference between something that's just an ache and pain or something more serious?
It's not always that easy. In fact, a lot of the patients that I see who are in their 40s and their 50s are golfers or tennis players who have shoulder pain. And sometimes it can just be a little bit of rotator cuff tendinitis, and sometimes it can be a tear in a tendon. And if we neglect the tear and it's allowed to atrophy or go on and not get treated, that can lead to more serious problems like arthritis. So I think, again, getting it checked out is the right thing to do.
What do we do if we're running the day before and we woke up with a swollen knee? Is that something you simply ice, or do we come to someone like yourself?
If it truly is swollen, and sometimes it's hard to tell yourself if it's swollen, sometimes it just feels stiff, and if it's a recurrent problem, it can be a torn cartilage in the knee, or it could just be arthritis. But I think it's important to know, because we can treat these things very effectively and get you back on the road to health.
If someone's coming to you with these running issues, aches and pains, do you ever say maybe running isn't the safest way to stay in shape?
Well, maybe running, I might suggest something else if running is the problem. But I think a lot of people just starting out exercising, I think it's a good thing as long as your primary care physician has cleared you from a physical standpoint, like a heart or lung standpoint. And I think that running or other types of exercise like cycling or swimming help us stay healthy. And it's easy for me to treat the problems that may come with that, maybe a minor strain or an ache or a pain. But if we don't exercise and if we don't stay healthy, diabetes, hypertension, obesity, those things I can't fix. Minor strains and sprains I can.
And back to the knees, what are ways that you can protect the knees so that we can keep on running?
I think the most important way to protect your knees is to stay healthy and exercise to begin with. Studies have shown, perhaps in ligament tear prevention, that strengthening your quadriceps muscles and hamstrings can help prevent injuries. So staying healthy, staying strong, staying active will prevent injuries in the long term.
Dr. Kinnard, thank you so much for being here with us.
My pleasure.
To learn more or to contact Orthopedic Associates of Central Maryland, call 410-644-1880 or on the web at mdbonedocs.com.